Let's talk about the lungs. And the lungs, as we know, those are the main organs of the respiratory system because inside them we will have the alveolus for the gas exchange. We have two lungs, left and right. The left lung is smaller than the right lung because the heart is leaning a little bit toward the left lung and therefore it takes some space out of it. The lungs are protected by the thoracic cage, by the ribs, and those ribs are connected through the intercostal muscles which will help in breathing. Both lungs are laying over the diaphragm and the diaphragm would also contract and that will allow the air to move in and out. For the right lung, since it's bigger, it has 3 lobes, superior, middle, and inferior, whereas the left lung just has the superior and inferior lobes. Those lobes are separated by fissures. In the right lung, between the superior and the middle, the fissure, we will call it the horizontal, whereas between the middle and the inferior, and also in the left lung, between the superior and inferior, this fissure, we'll call it the oblique fissure. Also, this dent in the left lung where the heart is sitting, we'll call it the cardiac notch. We'll see it in the lab that there is kind of a cavity there for the heart. Importantly, one thing we need to remember that the lungs have their own serosal membrane. And this serosal membrane, we'll call it the pleura of the lungs. So we have a very thin membrane of 2 layers. As you remember the serosal membrane, we have the parietal pleura, which is away, that is touching the costal muscles, intercostal muscles, and the rib cage. Then we have the visceral pleura, which is touching the lung itself, and between them there is the pleural cavity. This filled with the fluid. Now, if you remember the serosal membrane in general, to reduce the friction between the lungs and the hard structures in the thoracic cage or even in the diaphragm. Okay, so that's the pleura of the lung. Now this, we will come back to it later and we will see some physiology there. Okay, let's talk actually about the physiology of the lungs. Now, we will have the general process of getting the air in and out. We'll call it the respiration, as you know, as a general process. This respiration is divided into 4 processes. There is the pulmonary ventilation, which is the movement of the air in and out of the lung through the nose. Then we have external respiration, exchange of oxygen, CO2 between the lungs and the blood. Then the transportation of oxygen and CO2 into the blood, and then the internal respiration, exchange of oxygen and CO2 between the cells. We can draw them like this. So here we have the air, here we have the lungs, here we have the blood, and here we have the tissue, the cells, or the organ, whatever you want to call it. So this movement of air from the atmosphere, let's say outside or atmosphere, so we are not confused with the word air. So this movement of air between the atmosphere and lungs, okay, this is the one happening through the nose. Okay, this will call it the pulmonary ventilation. Okay, so the pulmonary ventilation is the movement of the air between atmosphere and the lungs. Then this air or this oxygen, we need to move it into the blood. So it's between the lungs and the blood. This we will call it external respiration. External respiration. Then in the blood, we will have gas transportation. So here in the blood, we will have gas transport. But then between the blood and the tissue, we will have internal respiration. So those are the 4 processes of the general respiration. We need to get the air into the lungs, and from the lungs we need to get it into the blood. In the blood will transport it through the cardiovascular system, and then around the tissue we need to get that oxygen to the tissue. And also the same, we need to get the CO2 back from the tissue to the blood. The blood will transport it to the lungs, and the lungs has to expel it outside to the air. Okay, so those are the 4 processes of respiration, and that's all what we will try to understand in this chapter, starting with the pulmonary ventilation. So let's go back to here. As we said, the pulmonary ventilation is that movement of air from inside the lung to the atmosphere. And to understand how this air is moving, we need to establish a few things mainly in physics. Okay, so think of it like this. If you have two chambers connected to each other, the gas pressure, they are filled with gas. Okay, so here, if you are injecting gas into this chamber, and as long as they are connected, the gas will travel or move to this area. It will diffuse. The gas will move from area of high concentration to the area of low concentration. Until when? Until we have equal concentration in both chambers. Okay, until we have equal concentrations in both chambers. And this equal concentration, it means in this particular case, you'll have equal gas pressure. Okay, so the gas is moving from the area area of high concentration to the low concentration, or technically from the area of high pressure to the area of low pressure. Until when? Until we will have equal gas pressure. Okay? This is one thing we need to establish. Another thing we need to establish is the relationship between space and the pressure. Now, this relationship is inversed. What does it mean? It means low space leads to high pressure. And if you increase the space, you will reduce the pressure. What does this mean? You need to think of it as a chamber. You have a chamber. This chamber has a cap, okay? Has a cap that you can slide it up and down. And this chamber has gas. The amount of gas is fixed. Let's say maybe we have 500 milliliter of gas when the cap is here. But now if I press the cap down, so I'm squeezing the same amount of gas into smaller area. Okay, so here in this case I have less space, okay, comparing to the space here, and therefore I will increase high pressure, high gas pressure. Whereas if I expand this cap all the way to here, it means now I have high space or more space, and therefore the gas molecules has more space to move in, and therefore this will lead to less pressure. Think of it as a balloon. When you have the balloon, you put a certain amount of air in the balloon, okay? But then you can squeeze the balloon, okay, and try to trap all the air into a smaller area. So the pressure here would increase in this area. Whereas you can also expand the balloon without putting more air inside, and that would cause less pressure in the balloon, okay? So that's the concept. So those are the two things we need to establish, that air is moving from areas of high pressure to area of low pressure, and this pressure is opposite to the space. If we increase the space, we will reduce the pressure. Okay, let's go back to here. So here we have the atmospheric pressure. This atmospheric pressure at sea level, it's 760 millimeter mercury. This is fixed. Now, the lungs are connected to the atmospheric pressure, and inside the alveolus we have intra-alveolar pressure. Since you think of them that those are connected, two chambers are connected, right? So the air here and the air here should have equal pressure, 760 millimeter mercury. If we stop breathing for a second, the air pressure in both is 760 millimeter mercury, or call it 0 for simplicity. So the intra-alveolar pressure will always try to match the atmospheric pressure. Then remember the pleura? This cavity, the pleura, we said this is filled with the fluid. This fluid causing a pressure, of course, right? If you put any fluid in a small chamber, in a small area, it will cause a pressure on the chamber. So here we have a pressure on the lungs, toward the lungs. But this pressure, the intra-pleural pressure, is always less than the intra-alveolar pressure by around 4 degrees. So if this is 0, this is minus 4 millimeter mercury. Or if this is 760, this should be 756. It's always less. Why we need it always less? Because to keep lungs open. If this increased, let's say if this becomes like 2, so instead of 760, it became 762, it means that we have more pressure on the lungs, and the lungs will collapse. Kind of we are squeezing the lungs. Think of if you are in a room, okay, and in this room there are people pushing on the walls toward outside, and then there are people outside pushing on the walls from outside toward inside. So if the power of those people is more than the power of those two individuals here, then it means they are going to shrink the room on those people and it will collapse, which we don't want this to happen into the lungs. That's why the intra-pleural pressure is always less than the intra-alveolar pressure. And the difference is always 4 millimeter mercury. The difference is always 4 millimeter mercury. This difference we call it transpulmonary pressure. So here now we have intra-alveolar pressure. This will try to equalize the atmospheric pressure. And we have the intra-pleural pressure is always less than both the intra-alveolar and the atmospheric. Okay, so now what we are trying to understand is how we are moving the air from outside to the lungs. So we are trying to understand how air is moved into lungs. Okay, so let's go back to here and remember this, what we talked about here. So if you have the two lungs, this is the bronchus, this is the first lung, this is the second, here atmospheric pressure, and here intra-alveolar pressure. The lungs, in inhale and exhale, what do we do in inhale? When we inhale, we expand our lungs, okay? So when we inhale, instead of the blue line, our lungs will become this size in inhale. So what's going to happen in the intra-alveolar pressure based on this this relationship. We're going to increase the space, right? Expand the lungs. It means expand or increase space inside lungs. This leads to what? In terms of the pressure, it will drop intra-alveolar pressure. So initially here in the blue, let's assume it was zero. Okay, atmospheric pressure is 0. But now we expand the lungs, so it dropped into -1. Okay, let's assume now it's -1, the intra-alveolar pressure. But here is 0. This is the area of high pressure. Therefore, the air will go inside. Therefore, air moves into lungs. This is during inhalation. When we inhale, we're expanding our lungs. That would increase the space in our lungs. That will drop the intra-alveolar pressure, and therefore the air moves into the lungs because of pressure difference between atmospheric and intra-alveolar. So this is what happens during inhale. What about during exhale? When we exhale, we're going to squeeze our lungs. Okay, so now we're moving from here to here. We're squeezing our lungs, trying to push the air out. So in this case, what happens to the space? In exhale, we're squeeze lungs. So in terms of space, this is what will happen. This will lower the space in lung. What will happen to the pressure? It will increase pressure in lungs also. What type of pressure? Which pressure? It's the intra-alveolar pressure. So here it was -1. The blue was 0. Now, since we shrink the space, it might turn into +1. Okay? But the atmospheric pressure is still 0. This is the pressure in the air. We don't have control over it. So it will remain 0. Now, inside the lung, we have an area of high pressure compared to outside. The air would move outside. The air will follow the area of low pressure. So here, since we have increased the pressure in the intra-alveolar pressure inside the lungs, then air moves outside. Why? Because intra-alveolar pressure is bigger than atmospheric pressure. Okay? So this is the movement of the air into and outside the lungs. When we expand, when we inhale, we're expanding our lungs. That will drop the pressure. The air will flow, the area of low pressure. When we exhale, we're squeezing the lungs. This will increase the pressure and the air will flow out to the area of low pressure. So this is the pulmonary ventilation. Now here the intrapleural pressure, again, the point of it is just to keep the lungs open. So there is no gas is getting into this area. No oxygen is getting into this area. Just make sure you are clear on this. We are not playing in the pressure here. The pressure is always fixed. And the intrapleural pressure is always fixed. And it's always less than the intra-alveolar pressure. So even if this moves to -1, then the intra-alveolar pressure will move to -5. If this moves to +1, the intra-alveolar pressure would move to -3. Okay? So the difference is always 4 between them. Always 4 millimeter mercury. So the intrapleural pressure is always there just to keep the lungs open. It's always less, but it's not directly involved in the gas exchange. No gas will get into this area. All the gas would remain here. So the expansion of the lungs is happening because of the diaphragm. The diaphragm contracts. It will pull down when it contracts, and that's what increase the space in the lungs. The external and intercostal muscles also will contract, and that would help in expanding the thoracic cage. And therefore, we're expanding the lungs and the air will flow in. When both relaxes, the diaphragm and the external intercostal muscles will relaxes, they will press the lungs or squeeze the lungs, and therefore we are creating an area of high pressure and the air will flow out. So a respiratory cycle is just one sequence of inspiration and expiration. One cycle of inspiration and expiration, or inhale and exhale. Okay, I will stop here. In the following video, we'll talk about the respiratory volumes and capacities.